Hi, my name is Allison Campion, and the social issue I chose to focus on is healthcare discrimination of gender minorities. This presentation is going to look at the background of this um, social issue, the ideology behind it. So, how did this become an issue? Conflict theory. It's going to explain what conflict theory is, and how it came to be. Theory application. It's going to apply conflict theory to my social issue. And then you're going to see empirical studies that will explain the issue better. So before I talk about the background, I'm going to show a video and then talk a little bit more.
People who identify as LGBTQIA+ experience unique challenges with accessing appropriate care, particularly individuals who identify as transgender or gender nonconforming. Transgender individuals encounter high rates of discrimination, as well as a lack of awareness about transgender-related health issues among healthcare providers. They face obstacles with receiving transitioning healthcare services, as well as primary care, and experience a high prevalence of mental health conditions. Despite attempts to limit or deny care in certain regions, there are parts of the country that have enacted legal protections for LGBTQIA+ patients. In the District of Columbia, a minimum of 2 hours of LGBTQ cultural competency training is required in order for health providers to renew their license. This training highlights appropriate terminology, risk factors for patients who identify as LGBTQ, and addresses underlying cultural biases. And overall, it can help diminish some of the barriers transgender and non-gender conforming people face when seeking the care they need.
So, transgender people are part of the LGBTQ community. This includes your trans men, trans women, genderqueer, and non-binary people. Of course, the big idea of this presentation is discrimination against transgender individuals in healthcare. What does it mean by widespread problem? In this video, it talks about educating healthcare providers on how to properly care for transgender individuals. But in reality, that's really not what's happening. Our healthcare providers are not educated everywhere, and it shows when looking at research that supports our our transgender people being discriminated against in the workplace. I mean, in the healthcare setting. Fear of mistreatment. Some trans people won't even go receive healthcare because they're scared. They don't know if they're going to be safe or if they're going to be discriminated against. Negative interactions. These are our trans people who trust our care providers, and they have one bad interaction and they can't trust them and they don't go back. The fear of mistreatment and negative interactions is something that's really dangerous for our trans people because this then puts them at risk because they're not receiving health care. They're not getting regular checkups. They don't know if everything's okay. And in some cases, they're even refused medical care just because they're trans. And then, of course, lack of education. This is something that's huge. Our healthcare providers are not educated enough on how to properly care for our trans individuals. And this, in turn, creates a really negative environment for our trans people. So, the ideology behind how this issue came to be. So first, of course, the root cause is discrimination. That's the root cause behind everything we'll see in this presentation, discrimination. Closed-mindedness. This is the lack of empathy and failure to interact with these individuals. These are people who don't want to get to know a trans person. They see one, they're not going to talk to them. They know they're trans, they're not going to interact with them. They don't have any empathy for what it's like to be a trans person and the things that they struggle with. And because of that closed-mindedness, they don't care to get to understand those things. Outside influences, religious beliefs. This is a huge outside influence. It can cause preconceived notions because of what's learned or what's taught growing up at a young age. And this is just ways that people grow up and things they just won't grow out of. You can also look at conservative political views, resulted in clouded judgment. This is something that's huge in today's world. Because of the conservative views that are leading our country, the safety of our trans people are at risk. They're losing their access to healthcare and they can't do anything about it. When it's already unsafe, now they're losing the choice to even go. Historical patterns. Queer identities being classified as a disorder in the DSM was something that was happening in our history. And still today, people who identify as transgender are being classified as having a gender disorder. And this, of course, creates stigma amongst trans people because it makes them feel like something's wrong with them when really that's not the truth. And traditional gender norms. These are the people that are stuck in the mindset of what is normal or how someone should be this or that. And there's only two genders. And that's just not the case. They need to become educated on this topic so they can understand better that that's not true and open their mind to what it might be like to experience these discriminations as a transgender person. So, we're going to talk about conflict theory. What is conflict theory? So Karl Marx created this conflict or this theory, and it's a sociology theory, but it can be applied to social work in many different ways. The main idea of this theory is dominant groups versus minority groups and the power that the dominant groups hold over the minority groups. An example of this is wealthy people versus people who are in poverty, or white people versus people of color. Both of those dominant groups hold power, and that power affects our minority groups. And it just shows the power dynamic and how those dominant groups hold that control. And then, like any theory, it has its strengths and its limitations. Some strengths that this theory has is it brings the uneven power dynamics to light for people to understand. It really shows those uneven power dynamics. It shows how those white people have power and the people in poverty don't. How the white people have power and how it's not the same for people of color. It really brings to life um those dynamics that wouldn't be brought to light without this theory. It also focuses on the inequalities that present within our society. Without this theory, some people may not understand the inequalities that exist within our society and they don't care to get to know it. But understanding this theory will allow people to have a better understanding of the society they're living in today. And limitations. This theory does not really speak much about any type of social stability. It focuses really well on the bad, but it doesn't focus on the good. And to some people, that could mean that this theory is one-sided because it only focuses on the bad. Application. How can this be applied? It can be it can be used to explain any type of uneven power dynamics in regard to social problems in our society. So, any type of uneven power dynamic, this theory is going to be able to explain and allow us to learn and understand why these things might be happening. And then this is Karl Marx, the man who created this theory. So, how does conflict theory affect my social issue? So, in this um, situation, the gender minorities are going to be our minority group. Healthcare workers are going to be our dominant group. And healthcare professionals are going to use that power that they have to discriminate against our um, transgender individuals. This theory explains very well the uneven and unacceptable power dynamics between trans people and healthcare professionals, and how they use that power to create an environment trans people are not completely comfortable with. They don't feel as though they need to be educated or go against their own personal biases. They don't want to confront. It brings to light the uneven power struggle trans people face in the society and gives us an understanding of how unstable our society is in today's world when it comes to trans people and the healthcare system. So now we're going to look at the first study I used. This study is called Healthcare Avoidance Due to Anticipated Discrimination Against Transgender People, and this was conducted by Komoot and a couple of other people. So what was it studying? It was studying the avoidance of healthcare. What were they trying to find? They were trying to find if gender minorities are actually avoiding healthcare. So the main idea or the main goal of this was to decide, are they willingly avoiding healthcare? How was it studied? They were asked a question about healthcare and they used their answers to then figure out what group um, uh, what was discriminated against. So what were the findings? It was found that trans men had the highest amount of discrimination, followed by trans women, and non-binary was the lowest. Although it was the lowest, they still experienced discrimination. And people who were not perceived as their identifying gender were more likely to be discriminated against. And it was also found that this was an intersectionality issue. So what are the recommendations? All groups were, sorry, recommended healthcare professionals are unaware of their own biases, so they need to become aware of their biases so they can be better for this population. They need to use inclusive language. And um, healthcare agencies should assess policy and become more inclusive. They should make it so that trans people are not discriminated against and they can feel safe where they're going to receive this healthcare. My second study, called Common Barriers to Healthcare for Transgender People in the U.S. Southeast, was different from what I looked at because it's focused on one specific area, and the study was done by Austin Johnson. So, what were they studying? They were studying barriers to healthcare among transgender people in the U.S. Southeast. And what were they trying to find? They were trying to find if there were actually barriers, and if there was, what those barriers were. How was it studied? They did a 120-minute focus group, and the participants had to be 18 years or older. They had to identify as transgender, and they had to be in the Southeast. They answered a demographic question prior to the focus group, and then they talked, and they got their findings from the conversations they were listening to. So, what were the findings? It was found that patients fear and mistrust their healthcare providers. It was found that there was inconsistency in treatment availability. Disrespect and insensitivity was something that was also found, and mistreatment as a result of social identities and different circumstances was also found. It was found that there was a lot of barriers that our trans folks have to overcome when it comes to healthcare, when there shouldn't be any barriers at all. So, what are the recommendations? Be mindful of patients, the challenges they face, and provide a high standard of care. So basically, the findings were to be empathetic, understand that trans people have a different experience in this world than other people do, understand that their journey in healthcare is not as easy as everybody else's, and at a more basic level, just provide them with the care that everybody else is provided. That's all that we need to do to create a safe place for our trans people to feel like they can go and receive the health care that they need so they're not put at risk anymore. Um, My third study was a self-reported discrimination in healthcare. Um, this study looked at people who reported being discriminated against within healthcare. So what are they studying? Or sorry, this study was conducted by Amanda Rodriguez. And what was she looking at? She was looking at self-reported healthcare discrimination due to recognizability. So, in other words, she was looking at discrimination for people who didn't look like the gender that they identified with. So, what was she trying to find? She was trying to find uh, the discrepancies within the different healthcare settings. How were they different? Were they in every healthcare setting? And how those numbers differ in the end? How was it studied? She looked at these individuals' places and researched and found what these findings were with people who have actually experienced and self-reported the discrimination they were experiencing in each of these individual fields. So what were the findings? She found that within the mental health field, 14 point, or not field, within the mental health healthcare, 14.5% of people reported being discriminated against. In emergency rooms, that number was even higher at 16.8%. And doctors in healthcare was the highest with 26.7%. And it was more common for people who didn't look like the gender that they identified with. And to add to it, it was even more common for people of color. And it was 2 or 3 times more common. So our trans people of color are experiencing the discrimination at a higher rate than everybody else, making it even more dangerous for them. So what are the recommendations? The recommendations for this are to just have more queer health professionals, uh, more queer health professionals should have the chance to educate people. Hiring processes should focus on including queer and trans professionals, and education needs to be focused on more. If we bring in people who walk the shoes of these people who are experiencing this discrimination, then it's gonna create a more inviting and safer system for our trans individuals to get the care that they deserve, just like everybody else. Um, my fourth study was state policies and healthcare use among transgender people in the United States. This study was conducted by Tamara Goldberg. This one was different than anything I did because it focused on policy, but not only did it focus on policy, it looked at a state to state level rather than looking at individuals. So what were they studying? Um, they were studying transgender state policy and the link between healthcare. What were they trying to find? They were trying to find um, the association between transgender specific state policy and healthcare advice due to fear of mistreatment. So, how was it studied? He looked at these different states and found where and looked at different policies to see if there was any protections put into place for our trans people. So what were his findings? It was found that none of the individual policies were associated with healthcare use. And it was shown that living in states with more protective policies was associated with reduced odds of avoiding healthcare due to fears of mistreatment. So what he found was where trans people feel safer, they're going to go get the healthcare that they need. They're not going to be as at risk as our population who doesn't feel safe. And in the places, I found that there was no policies associated with healthcare. There was nothing in place to keep our trans people safe in these states that he was looking at. So what are the recommendations? Or sorry, how was it studied? I forgot that one. He used data from the 2015 US Trans Survey and used it to conduct his research in 2018 to 2019, and he used that to relate back to his states that he was looking at, like I mentioned earlier. So what were the recommendations? Policies across the country should work to protect transgender individuals, especially trans people of color, because like mentioned before, our transgender people of color are even more at risk than our transgender people are alone. And policies should be created with a focus on health equality. When we're creating these environments for people, we should be making them safe for everybody, not just the people we want to pick and choose to make it safe for. And my final study dealt with interviews with transgender people and their experiences with healthcare professionals. So what are they studying in this study? The experiences trans people have with healthcare professionals. What were they trying to find out? They were trying to find out if these were negative or positive treatments. or interactions between our healthcare professionals and our transgender individuals. How was it studied? 20 transgender individuals aged 18 to 74 were interviewed, and this study was different from the other ones I looked at because it used words instead of numbers. She interviewed people and got their real world experiences and to um, used that to better explain how our transgender people are being treated. I think personally that this was a good approach because it allows us to see things from their point of view. It allows us to talk to them and understand what it's like to actually go through this. So, what were the findings of this study? The findings were that transgender patients are facing disrespect from healthcare professionals. This pushes them away from using health care resources that they might need. And like I mentioned before, that is extremely dangerous for our trans people because they're not um, getting their gender affirming care that they may need to save their life, or they may not know about underlying health issues. And seeing a doctor could make them aware and save their lives. But because they don't feel safe in the environments that we're creating for them, they choose to not go. And they choose to not know what is happening to them out of fear of not being treated correctly. So, what are the recommendations? Transgender knowledge needs increase in general, both in specialized gender healthcare as well as basic healthcare in general. Like, even in a field where that's all that they focus on, they still need to be educating. They still need to be educated because things are always changing. Education is so important when it comes to understanding and creating a safe environment for trans individuals. And in saying that, I thought it was important to hear the voice of a trans person, someone who's walked the shoes and dealt with this discrimination. I'm going to show a YouTube video of a story of a trans woman who dealt with some really serious discrimination just because she was trans, and I think it's important that we understand and listen what it's like to walk in the shoes of these people.
Tanya, who is a US based activist and advocate, visited a doctor for a lung ailment. To her horror, the doctor asked invasive questions about her sex change operation. She was hurriedly given some antibiotics and sent home. 3 months later, Tanya discovered that she had lung cancer.
A nurse and a doctor cornered me in the emergency room. The doctor said to the nurse, "Should I ask?" And she said, "Yeah, go ahead and ask." And he asked, and I'm in there coughing up blood. Uh, you know, did you have a sex change? What do you have down there? And I said, "Why do you need to know that? I mean, you know, explain to me why you need to know what my genitals are." And he couldn't give me an explanation.
Tanya is one among the many transgenders around the world who face this stigma in their everyday lives.
There's a lot of discrimination that still exists, particularly for transgender patients. What we know from a recent large national survey is about 1 out of every 5 transgender individuals is refused care because of being transgender. I've had patients who were literally kicked out halfway through their medical visit after revealing that they were transgender, that they were told they weren't welcome. A high proportion of folks actually face physical and verbal violence in medical clinics because of being transgender. This is a major problem that we often don't want to talk about.
Transgenders have been recognized as the third gender by many countries. However, this step alone hasn't brought much relief to the transgender community.
That video does a really good job at explaining what it's like to walk in the shoes of a transgender person experiencing this discrimination. These are the references that I used. But I wanted to wrap this up by saying that Karl Marx's conflict theory does a good job at explaining the social issues trans people face within the with healthcare professionals. The lack of education and the ability to let go of their own biases creates um, this power dynamic and social struggle that we see today. It also creates a environment that isn't safe or comforting for our trans individuals. While all trans people may not face the same challenges, many of them will experience negative interactions with doctors and healthcare professionals. Many will then avoid going to receive healthcare at all, which puts them more at risk. Those who can be visibly identified as transgender or who are people of color are often more vulnerable to this mistreatment. This population needs to be a focus when educating medical staff, and staff need to be able to provide an inclusive setting for healthcare. This population is vulnerable, especially when getting healthcare, and we need further um, protections for them. Now, as um, uh, in saying that, like creating that space for our trans individuals is something that is so important. We can't be putting an entire population at risk because they're too scared and they don't feel safe in the environment. That's just not fair to them. And creating that space is something that's so important. And to me, I feel like as social workers, we can create that safe space. But how can we do that? When we have a trans client come in, we can ask them their pronouns. And when they tell us what they are, we can respect that. Use those pronouns. Make them feel like we care and we understand that they have their struggles and make them know that when they walk through our doors, they're safe with us. And something else that's really important to note is remember that not all trans clients are the same. It's the same as working with two clients who are struggling with substance abuse. Their story is not going to be the same. So every trans person that walks through our door is not going to be the same. Their story is going to be unique to them. It's going to be a new challenge for us when they walk through the door to get to know them, to make a plan for them that's going to be the best and set them up for success in the best ways that we can. Um, Understanding that difference is going to be one of the key points to creating a safe and inclusive environment for our trans um, clients. And speaking of inclusivity, learning how to improve the inclusivity of your workplace is also going to be ideal. When we have a trans client, and they're walking through our door, we want them to feel like they're walking into a safe place. We don't want them walking in and looking around and wondering if this is a place that's going to be okay for them. We want them to walk in and see a trans flag on the desk and know that when they walk through our door, they're going to be safe with us. Our trans people face a lot of issues within different within healthcare, and it's important that we keep it safe for them. And challenging negative views of staff around you. If you hear somebody talking negatively about our trans people, educate them, challenge them, make them think about the choices that they're making and how that's affecting the people around them. Make them understand that that's not okay and that trans people are people too. And finally, keep learning and developing skills for this population. It's important, extremely important, that we stay educated and we keep learning so we understand how to best help this population. When we learn, we can create a safe place that allows our transgender um, clients to feel safe and at home with us. And as social workers, that is always our number one job is to make our clients feel safe, and transgender clients should be no different. So staying educated and understanding that everybody is different and their stories are different and using those pronouns are going to make our clients that much more comfortable because as social workers, that is our job.